You are called to the scene of a motor vehicle crash, where you find a victim who was thrown from the car. You find severe damage to the front end of the car. The victim was found lying in a field 30 feet from the upright car.
Scene safe, BSI. Do I only have one patient?
Only one patient is found.
Okay, so I won't need to call out for additional help. All right. The general impression is that he's pale. My mechanism of injury is ejected from a car. I'm going to grab C-spine. We suspect he may have a spinal injury. Can I pass it off to an invisible EMT?
Yes.
Okay. Sir, can you hear me? Can you hear me?
Unresponsive.
Okay. So we determined that this may be a life-threatening injury. All right. I'm going to open his airway with a jaw thrust. I'm going to look in his mouth. Do I see anything?
Nothing.
I'm going to attempt to insert an oral airway.
He does not accept the oral.
Okay, I'll take it back out. I'm going to look, listen, and feel for breathing. Is his breathing adequate to sustain life?
Yes.
Okay, I'm going to place him on 15 liters non-rebreather, and I'm going to check his lung sounds.
You find decreased lung sounds on the left side.
Okay. I'm going to expose his chest so that I can see if there's anything hindering with his breathing. I don't see anything over there. I find bruising on his left side.
You also find paradoxical motion.
Okay, we're going to treat the flailed segment with a bulky dressing, and it's going to stabilize the chest.
Stabilized.
Okay. I'm going to check pulses.
You find no distal pulses.
Okay. Check his carotid. It's full.
His pulses are weak and rapid.
Okay. His perfusion, he looks pretty pale.
He's pale, cool, and clammy.
Okay. I'm going to do a blood sweep. I notice blood here.
Correct.
Okay. Is the bleeding controlled?
It is controlled.
Okay. I'll treat that later. We determined that he's an unstable patient and we're going to call out for ALS. All right. I'm going to do a quick rapid trauma. Is this a bone here coming out?
No, it's not.
Okay. Now I'm going to have my assistant put a C-collar on and check the back of the neck for step-off.
None noted.
Okay. And now we're going to check PMS and roll him on to the backboard. Checking the back for step-off. Any blood? Any injuries down his back?
None found.
Okay. I'm going to roll him back onto the backboard and finish backboarding him. And we would transport him very rapidly to the hospital. I'm going to start with taking vitals. About 108/70.
BP is at 72/60.
Okay. I'm going to check his carotid pulse. It's still strong?
No, weak and rapid.
Okay. I have a pulse of 68.
Pulse is 140.
Okay. I'm going to check his respirations. I got 14.
Respirations are 28.
Okay. I'm going to check his pupils.
Pupils are pearl.
Okay. And I already checked his lung sounds. His perfusion is still pale, cool, and clammy.
Correct.
Okay. Now, I would obtain a sample history, but he's unresponsive, so I can't do that, but I know that he has, his signs and symptoms are life-threatening. We already noted this in the leg injury. I'm going to check for any indications of an allergy bracelet.
None are found.
Okay. I also know that the events leading up to this where he was thrown 30 feet in the air from the car. Okay, now I'm going to go down and I'm going to do my detailed trauma assessment, checking the head, the face, looking in the airway for anything, looking in the nose, checking the pupils again, checking the ears.
Nothing's found.
Is there any tracheal deviation or JVD?
None.
Okay. I'm going down the arm for stabilization. Sir, can you move your hand? Can you feel this?
Unresponsive.
Going down the other arm for stabilization. Sir, can you feel this? Can you move your hand?
Unresponsive.
Checking pulses.
Still no distal pulses.
Going down the chest for stability. Is this holding up?
Yes, still stable.
Okay. Palpating the abdomen.
Abdomen is distended.
Pelvis stability.
Pelvis is stable.
Okay, I'm going to expose this area and assess this area in his genital region. Is this stabilized to the backboard correctly?
Yes.
Okay. I'm going to have my assistant come over here, wipe off the blood, and cover this with a sterile dressing. I'm going down the leg. I'm going to take off his shoes. Checking his foot. Sir, can you move this foot? Can you feel this foot?
Unresponsive.
Okay. Going down the other leg. Feels stable. Going up the foot. Can you feel this, sir? Can you move this?
Unresponsive.
All right, I'm going to check his pulses down at his feet.
No distal pulses.
No distal pulses. Okay. At this point, we are going to continue with our ongoing assessment. I'm going to go back and check his airway, breathing, circulation, and make sure all of our interventions are holding up. Make sure the oxygen is flowing correctly. Make sure that his paradoxal motion is stopped, and make sure that this is stabilized down here, this wound. And I'm going to also go back and reassess vitals every 5 minutes because he's an unstable patient. And I'm done.
All right. You can take your card and go back to the dispatch area.
Thank you.
Thank you.